Hello, welcome to the StellaLife Innovator Series. I'm Liz Lundry, and today I have the pleasure of talking with Dr. Robert Talac. Dr. Talac is a regenerative orthopedic and spine specialist at Renaxis, the Regenerative Orthopedic Center in Houston, Texas. He's been a researcher and has won numerous awards as a surgeon specializing in innovative in situ regeneration for orthopedic and spinal conditions. Dr. Talac has pioneered groundbreaking techniques using natural biomaterials to harness the body's innate healing abilities. Welcome, Dr. Talac. Thank you for joining me today.
Thank you very much, Liz. Thank you for having me.
It's
I
such a pleasure to
appreciate it.
have you here. As I wanted to ask you, how do you perceive the relationship between oral health and systemic well-being, and what key connections have you observed in your practice and research?
Thank you very much. It's uh, somewhat interesting question for orthopedists to talk about oral health, but I am focusing at least the last 5 years almost exclusively on regenerative procedures, and it's all about immunomodulation. So that relationship between oral health and systemic well-being is increasingly complex as we evolve our understanding of all these systems. And this oral microbiome, and problems like periodontal disease often affect systemic health. And because I focus on regenerative techniques, which it's all about immunomodulation and manipulating our innate ability to heal, to rejuvenate, if you will, diseased or injured tissues. Systemic health, it's very important part of it. So if we want to have a good outcome, we need to start optimizing human body, and it starts with oral microbiome. We all understand that oral microbiome is a part of entire microbiome, like a small bowels or a gut microbiome, affect systemic immune reaction, and subsequently it will affect outcome of my therapy. So I am somewhat unorthodox orthopedist because when patients come to see me, I start looking in their mouth. And especially when I see, let's say, dental colleague, they are absolutely shocked that I start looking at their mouth. And this is relatively new field, but I believe that addressing oral issues such as periodontal disease and reducing oral inflammation will ultimately lead to decreasing systemic inflammation and provide better results for me. So I I am trying to establish bridges between orthopedist and dentist because I truly feel that it's artificial that we deal with different parts of body, yet we are considered totally different physicians. I think we all are healers for beginning, and then proceduralists second.
Absolutely, and it is all connected. We're in complete agreement with that at StellaLife, of course. And with the emerging research that's out there, we're only just beginning to learn about the oral and the gut microbiome. And now I understand, is looked upon like the gut microbiome as as an organ system because of the diversity and all of the impact that these friendly microbes have on our bodily functions as human beings. So I think it's terrific that we're having more people like you appreciate that and use that so that we can be so effective with our patients. So could you elaborate on the impact of oral inflammation on systemic conditions such as cardiovascular disease and diabetes, and how clinicians effectively address this interplay in patient care?
Sure, sure. As I said, this is the part of interconnected systems. So the impact of oral inflammation is very well documented on systemic health, particularly in the context of regenerative therapies. And I believe that we need to underscore this relationship over and over because it's a part of the one system. So if you look at oral inflammation that, again, as I mentioned, periodontal disease or some other, that affects not only local tissues, but this also has a far-reaching systemic effect. This their inflammation leads to release a lot of inflammatory mediators, and they in oral cavity they go to the bloodstream, and subsequently they trigger systemic inflammation. And again, that may affect cardiovascular system. They may lead to diabetes. Like we have some autoimmune diseases, cancer, and ultimately in my field, which is regenerative orthopedic and spine care, which relies on immunomodulation to facilitate the tissue repair, I need to address chronic oral inflammation as the one of the potential factors that will affect my outcome. So I believe that we need to start in oral cavity because the chronic inflammation will disrupt the balance in immune system and effectively will hamper the tissue repair and subsequently my regenerative intervention. So I think that whether you are cardiologist or you are endocrine specialist, we all need to focus on the patient because that's ultimately what we are trying to heal. So I believe that collaboration at minimum with dentists or people that are specialists in oral health, it's paramount for us who are not that worse. So at the beginning, I think we need to at least understand our lingo. We need to collaborate, and we have to uh, optimize patient because they have same challenges, I believe, in oral or dental office when patient come with systemic problems and dentists look at the problem in the mouth and say, hey, how can I affect my or the overall outcome by optimizing a general strategy?
Yeah, absolutely. And it's all about controlling that inflammation because it is systemic and we see the signs. We just need to look in someone's mouth. And we can even do testing now to find out which pathogens they have above threshold and really look at very many more details than we could in the past. So we have that advantage now. And then with this emerging evidence that we're seeing about the link between the oral microbiome and overall health, what strategies do you recommend for maintaining a balanced oral microbiota and providing oral and systemic health?
Well, of course. So what I do in my practice, number one, it starts with a figuring out what we are up against. So it's all about diagnosis. So in my office, I will use saliva testing. That's one of the tests. I am not dentist, but I use the saliva test to identify a bacteria, fungi, and viruses. They play some role in oral health. So that will give me at least a baseline where we are up against. And of course, I do some tests like uh, high sensitivity C-reactive protein to know what the systemic inflammation is. We are trying to figure out what is the overall inflammatory load and how does it affect the patient health at the moment. And of course, in the context of what I do, then I will make some decisions whether I proceed with the therapy or to address the underlying problem first, because there is no point to start regenerative therapy when patient is fighting on multiple places chronic inflammation because the body is just not going to respond same way. So tests are first. The second part, of course, if I see that somebody has really terrible problem, I will then consult with my colleagues. I do see some patients, let's say, with neurodegenerative conditions like multiple sclerosis, for example. And we believe that there are some bacterial loads, especially Candida is one of the problematic fungi that is causing this problem. And of course, there are some others, but there are some secondary problems, like, for example, amalgam fillings, because you may have a heavy metal toxicity. So, when I see a patient with neurodegenerative condition, I again look at their mouth. I do some saliva testing, and many times I recommend that they would consult with their dentist to remove those fillings for some more biologically friendly one. So again, so in practice, I would recommend three things. Number one, diagnosis, so we at least are aware what we are up against. Second, do some the systemic markers of inflammation, such as high sensitivity C-reactive protein. Second or third, after the diagnosis, I would then proceed with the treatment. And of course, I use a saliva testing and these measures that I measure to monitor patient progression. And of course, if it gets over my head, so to speak, I consult with dentists to say, hey, what do you think? What should we recommend? I am usually not going further than recommend some brushing or flossing and some dietary modification. I am not expert, but I know people, they can help me to address, let's say, periodontal problem. The 80% of Americans have periodontal disease and they don't know about it.
Right.
So I believe these are kind of practical steps how to incorporate what I am saying into everyday practice.
I'm in complete agreement with you, and that is really a brilliant and very logical approach. And all of us need to use this all-encompassing approach because we can't just look at one area and not examine everything else. So the testing is just a wonderful way to not only diagnose initially, but then, as you're saying, monitor their progress and see what's happening again, so we can reduce that inflammatory response. So in your experience, how does preventative dental care contribute to overall systemic health in your view? And what steps can individuals take to prioritize oral health as an integral part of their wellness routine? It's like
Yeah,
educating people, right? And including our patients.
yes. Well, unfortunately, this is profound question because unfortunately our healthcare is not really healthcare; it's a disease care.
Exactly.
We all are focusing on finding out the problem, disease, and then do surgery, procedures, fix it. And a lot of our patients believe that they should wait until the problem is bad enough to see us.
Yeah.
I think that what I see more with these regenerative strategies that it should be more preventive, or if you will, predictive. Because if I, let's say, on myself, I do labs on myself every 3 months, and when I see that something is getting off, I start intervening before I have symptoms. So I would love if we in orthopedics would at least implement what dentists do routinely, preventive dental care. We don't have such a thing that come every year to see how your back or your knees works. And we now have a pretty good data that we can predict problems like, for example, knee arthritis 5 years before they can have a symptoms. But I sometimes, and forgive me, maybe cynically, believe that a lot of doctors are busy and they don't really do any prevention because at the end they like to do surgeries and procedures. And I think that we need to move our or focus our paradigm from treatment to prevention. I think that if we would ideally prevent disease to develop, the patients will be happy, there will be less pain, results will be better. And that's why I think that preventing dental care and, of course, systemic healthcare goes hands in hands. So again, I don't see these as two different areas, but I'm fully aware that we are kind of separated in our silos. But I think that educating patients that they need to be proactive, we can call it prevention. Some of those call it predictive because we can do some labs or we can do tests. We have now variables that will tell you about your heart rate, your sleeping, your emotional state. We have a lot of data and we need to have better intel, meaning interpretation, what may be going down the road. And again, as I used to do several hundred surgeries a year when as a traditional orthopedic spine specialist. But these days I do 20, maybe less than 30 surgeries a year because all these regenerative techniques just eliminate need for surgery. And so I truly believe that proactive, preventive model is the way to go.
Absolutely. And I think that these doctors are doing their best because they've been trained to do this reactive approach with the surgeries and everything else. And now, as we're learning more, with the education should begin, in childhood with children and not in dentistry, of course, we're on the forefront because we see our patients more often than they see their physicians, so we can help with that. But ultimately, my dream would be to have this available in the schools with really great nutrition for everybody and starting to teach these children about these issues in terms that they can understand. And then we can really be proactive and really see a much brighter future and lower our healthcare costs as a nation because we have
Absolutely.
the highest healthcare costs on the planet here in the US. So I thank you so much for the work that you're doing. It's very exciting and look forward to hearing to more of your breakthroughs and your procedures. And thank you so much for joining me today so we can share this information with our community.
Oh, absolutely. Thank you very much for having me. I appreciate this opportunity to shed some light on maybe different kind of orthopedics.
Yeah.
Although I jokingly said I used to be glorified carpenter, now I'm becoming more a healer. But uh, maybe just was last thing I understand that physicians are trained. I used to ask myself, can I do this? And now when I am almost 30 years into medical practice, I ask, should I do this? So just the fact that I can do surgery, it doesn't mean that that should be focused on my practice. So yeah, I appreciate this ability or opportunity for me to build another bridge. And I greatly appreciate that you having me.
Well, I'm inspired, and I'm sure our audience is too. So, everybody out there listening today, thank you so much for joining us. And let's all learn more of more that everything we can do for our patients to really help them on a road to health. So, thank you all for
Thank
joining.
you so much.
Thank you, doctor. And we shall see you on our next Innovators interview. Everybody, please take care and stay well.